Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Mary Bollinger. Mary's had a thyroid problem. She's just started our thyroid program. She's had about 4 treatments. And we're just going to do a series of videos on you so we can show your improvement.
All right.
So why don't you just kind of tell us about your journey and, about the symptoms that you had and how long you've had them and what you've tried.
All right. For several years, I have had such dry skin that it would actually make sores on my body.
Okay.
And so then I've had a terrible time losing weight. I'm tired. I can't sleep.
What about like energy level?
Oh, it was almost nil. It was. Yeah. I didn't have any energy at all.
And have you had any trouble with hair loss?
Yes,
okay,
I have.
Right. And your outside third of your eyebrows. We still have your eyelashes, which is good.
Yes.
Okay, and then obviously, stomach and intestinal
yes.
type stuff. Yeah. Okay, so and one of the things, well, just kind of, you've had that for a long time, and it's just been getting worse and worse.
Yes.
And then what have you tried?
Well, my primary care doctor has done thyroid tests, but it wouldn't show that I had a low thyroid. It would, it came back within the normal range, but I still kept having these problems, and I just felt like that, all along I felt like there was something that needed to be done, but we couldn't find what it was. And so when I saw a list of when I saw your video on the computer, it was talking about, all of these things, and I thought, I'm going right down the list of the symptoms of thyroid. So I thought I would have this done.
Okay. Well, and when we talk about the video, we talk about lab values,
right.
and like, 0.45, 0.5. There's some, there's some variation, some as low as 0.35 and all the way up to 5.0. And so what we want your TSH, to be in 1.8 to 3.0.
Okay.
And so you can go in there and be, here or here, and they still say it's within the normal,
right.
but obviously it's not functioning as good. And then the lab tests that we do, they just did the TSH on you. We do 9 tests,
right.
and that's what, that gives us the information. But you could still have normal lab values, but not have thyroid function. And there's other thing, the pituitary gland can not be sending the signal right to the thyroid, so it doesn't make as much as what it's supposed to be. You could have the other things that we talked about in the video that can affect thyroid function. There's 22 identifiable factors and 6 patterns of thyroid dysfunction. So there's all these different things that it could be, not just a TSH. And so a lot of patients are like you. They've suffered for a long time, and they go to the doctor's lab, and our values are normal. So that's what, with all the testing that we've done, that's how we've been able to figure that out. But anyway, so, and the other concern is you with your health is, you've got to take care of your husband. And one of the motivating factors for you to come in was?
Yes, my husband has Parkinson's, and it's progressing quite rapidly, and I am his caregiver. So I have a lot of stress, and so I felt like that probably had some effect also. But yes, I have to get better so I can be his.
So that was one of the motivating factors. Is the way that you're going. You were wondering what you're going to be like in 1, 2,
right.
3 years down the road, and if you can't take care of him, then you're going to have people take care of you and him.
That's correct.
Okay, so you've only had 4 treatments,
right.
but sometimes all it takes is just that little bit of glimmer of hope when nothing else has worked for you and you haven't been able to get any improvement. So just let us know how you're doing.
I'm feeling better. I seem to have a better outlook on life. I don't crash at 2 o'clock in the afternoon the way I did. I'm sleeping better at night.
Okay.
So, I just feel like that I've come a long way in just the 4 treatments.
Yeah,
so.
It got to be exciting.
It
is for me.
It
to see it's going to change life. Okay, so, we're just in the beginning process. We've been doing the neurological treatment, we've done some other things. And now, we're getting ready to go into the full bore treatment, and get going. So if we've already had a little bit of improvement, that's a great sign. And what we're gonna do is we're gonna check back with you, in a couple of months, and so that
Okay.
we can just chart your progress. So at the end, we're gonna see the finished product and how good you, because most patients forget about it. They get amnesia as to how bad they were when they first
Oh.
did. And so I
Yes.
want to do these videos so more people can see the actual progression of the patients getting better.
All right.
Okay, so we appreciate you as a patient.
Thank you.
Look forward to getting you all fixed up, and thanks
Thank
for
you.
doing this.
You're
Thank you.
welcome.